Have you noticed changes in your size or firmness during intimacy and quietly wondered if there's anything you can do about it? I'm Dr. Sarah Mitchell, a urologist and pelvic surgeon with 10 years of experience, and I'm here to help men over 60 understand what's really happening inside their bodies and how science-backed training can restore strength, control, and confidence in just a few minutes a day. What I'll share with you today isn't a gimmick, a pill, or a surgery. It's an approach that uses your own body's hidden muscles to naturally boost firmness, stability, and even the way your size appears, no matter your age. For many men, aging brings a quiet list of frustrations that nobody talks about. Erections that don't feel as strong as they used to, a downward angle that wasn't there before, or an appearance that seems smaller than you remember. It's easy to blame hormones or think it's just part of getting older, but here's the truth. There's a powerful mechanical part of your body that most men never train, even though it's absolutely essential for sexual performance. Today, we're going to explore those hidden muscles together, understand exactly how they work, and I'll walk you step by step through a 3-minute daily routine that can transform both your function and your confidence. Before you can train these muscles, you need to find them, and the simplest way might surprise you. During urination, try gently stopping the flow midstream. The muscles you use to do that, without tightening your legs, abdomen, or holding your breath, are part of your pelvic floor. Now, this is important. Do this only once as a test, because regularly stopping your urine can actually cause bladder problems. Once you've identified that sensation, you'll practice it away from the bathroom entirely. Here's your foundation routine that you can start today. Find a comfortable position, either sitting or lying down, whatever feels best for you. Take a few natural breaths to relax your entire body. Now, gently contract those pelvic floor muscles as if you're lifting something inside, creating a subtle pulling sensation. Hold this contraction for 3 to 5 seconds, keeping it gentle and controlled. Then release completely for another 5 seconds, and that release is just as important as the squeeze itself. Repeat this cycle 10 times and aim for 2 to 3 sets throughout your day. You don't have to do them all at once. In fact, it's better to spread them through your morning, afternoon, and evening routine. While you're practicing, watch for these common mistakes that can reduce effectiveness. Don't squeeze your thighs, buttocks, or abdomen, as this defeats the purpose. Don't hold your breath. Keep breathing normally throughout. And don't push down, because the movement should always be a gentle lift upward. Most men find they can easily work this into their daily routine without any stress or discomfort. Even a few rounds while watching TV or reading can make a significant difference. Remember, this isn't about brute force or straining. You're training for control, coordination, and endurance, and the first improvements often come quietly. You might notice better muscle awareness, easier activation, or more stamina before you see any visible changes. If you're still following along, I'd love to know where you're watching from today. Comment your city and country below, and I'll give you a personalized greeting in our next video. It really helps me understand our community better and create content that speaks directly to your needs. Now, let me explain why this matters so much, especially after 60. Long periods of sitting can literally switch these muscles off, making them forget how to activate properly. Surgeries like prostate removal can disrupt nerve signals to these muscles. Natural age-related changes in coordination mean that even if the muscles are still there, they may not activate at the right moment when you need them. The consequences aren't limited to just firmness either. Men often notice a flatter angle during erections, reduced responsiveness to stimulation, and even what appears to be a shrinking look. This visual change is often completely misunderstood. The actual tissue length hasn't changed at all, but the loss of internal pressure makes everything appear smaller than it really is. The good news is that you can retrain these muscles at any age, without gym equipment, without drugs, and see real improvements in just weeks. Inside your pelvis lies a network of deep supportive muscles known as the pelvic floor. Among them, 2 play a starring role in erection quality: the bulbocavernosus and the ischiocavernosus. These muscles have one crucial job during arousal: to trap blood inside the erectile chambers and keep it there under pressure. The bulbocavernosus squeezes the base of the penis, compressing veins so blood can't escape. The ischiocavernosus reinforces that pressure, holding the shaft up and maintaining that upward angle men associate with youthful erections. When these muscles weaken through years of sitting, reduced activity, surgery, or simply disuse, blood escapes more quickly. The result is that erections feel softer, fade faster, and lose that stable, lifted angle you remember. This isn't just theory or speculation. A 2005 randomized controlled trial, published in BJU International, followed men with mild to moderate erectile dysfunction for 6 months. After targeted pelvic floor training, over 40% regained completely normal erectile function without changing any medication, and another 35% saw significant improvement in firmness, control, and satisfaction. The reason is beautifully simple. Strong pelvic muscles improve something called venous occlusion, the internal valve system that holds blood in the penis. With better closure, you get more pressure, more stability, and longer-lasting function. Here's what most men experience with consistent practice, and I want you to have realistic expectations. During weeks 1 to 2, you'll develop stronger awareness of these muscles, even if the contractions still feel weak. In weeks 3 to 5, you'll notice improved hold times and less effort needed to engage the muscles. By weeks 6 to 8, most men see noticeable improvements in erection angle and stability, plus more control during intimacy. And by weeks 10 to 12, you'll likely experience a fuller appearance, greater firmness, and for many men, renewed confidence, especially if blood flow was a limiting factor before. Pelvic floor training offers more than just sexual benefits. It can improve bladder control, support prostate stability, and reduce the risk of pelvic organ prolapse. It's low risk, has no drug interactions, and can be done anywhere. For men wanting to avoid dependence on medication, or who experience side effects, this is a safe, effective starting point. Here's a question that helps me create better content for you. What's your primary concern when it comes to sexual health? Maintaining firmness and angle during intimacy, or lasting longer and having better control? Type 1 for firmness and angle, or 2 for duration and control. Your responses help me understand what specific challenges to address in future videos. Once you can isolate these muscles comfortably, the next step is developing neuromuscular control, essentially teaching your brain to recruit them instantly when needed. Some men use biofeedback tools or guided apps to get real-time information on muscle activation, which can speed up progress, especially if you learn best by seeing or feeling direct feedback. Even without devices, you can practice quick rhythmic contractions to mimic what happens during arousal. Short squeezes followed by complete release train the muscles to respond rapidly, keeping you in control when it matters most. Once the basic contractions feel natural, you can add progressions to challenge the muscles further and accelerate your results. Try long holds, gradually building from 5 seconds up to 10 seconds while maintaining full control throughout. Practice quick pulses with rapid contractions for 1 to 2 seconds, then release completely. This builds reflexive strength for real-life moments when you need instant response. You can also engage these muscles during functional activities like climbing stairs, lifting light weights, or standing from a chair so they activate automatically in daily life without conscious thought. These small upgrades help bridge the gap between exercise and actual performance, making the improvements feel like second nature. Let me be clear about what you can expect. Pelvic floor training does not increase anatomical length, but by boosting blood flow and pressure, it fills the erectile chambers more completely, creating a firmer, fuller appearance that both you and your partner will notice. There's also a fascinating neurological benefit. When you contract these muscles correctly, you send stronger sensory signals to your brain. Men often report feeling more connected to their body, more in control of rhythm and timing, and experiencing more pleasure during intimacy. It's not just about performance, it's about restoring a sense of ownership and confidence over your own body. And here's a bonus benefit that might surprise you. Men who keep their pelvic floor strong often notice better posture, less lower back strain, and more overall energy because these muscles are actually part of your body's entire core support system. Think beyond just the next few months. Maintaining pelvic floor health supports better urinary control even decades from now, protection against post-surgical complications if you ever need prostate treatment, and confidence in physical intimacy without the constant worry of losing firmness mid-moment. You're not just training for now, you're investing in quality of life for years ahead. Let me share a story that illustrates this perfectly. Mr. T, 68 years old, came to me frustrated and defeated. He relied on pills before every intimate moment and worried constantly about side effects. We built a simple 3-minute routine into his mornings. Nothing complicated, just the basics I've shared with you. 10 weeks later, he told me something I'll never forget. For the first time in years, I felt in control. No pill, no planning, just me, confident again. That transformation wasn't magic, it was muscle. Hidden muscles he'd never trained before. Another patient, James, 72, had stopped initiating intimacy altogether because he didn't trust his body anymore. 3 months into consistent training, he not only regained reliable firmness, but he told me his relationship felt alive again. It wasn't just his body that changed. It was how he saw himself as a man. Performance issues can create a quiet cycle of anxiety that affects everything. The more you worry, the harder it becomes to perform, and the more the muscles lose coordination. Training breaks that destructive cycle. When you feel the difference in firmness, angle, and control, the mental weight lifts, and that confidence changes everything in the bedroom and beyond. Like any exercise, more is not always better, and this is especially important for you to understand. Overtraining can cause tension or discomfort in the pelvic area. If you experience pain, urinary changes, or anything unusual, see your healthcare provider immediately. For most men over 60, this is a completely safe, doctor-approved practice. But it's always wise to get clearance from your own physician before starting any new health routine. Every year you leave these muscles untrained, they weaken further. But start today, and in as little as a few weeks, you could feel changes that ripple through every part of your life. You've just learned one of the most effective natural ways to reclaim firmness and confidence after 60, using nothing but your own body's hidden potential. If this video has given you hope and practical tools you can actually use, please give it a like right now. It's a small gesture that helps more men discover these science-based solutions without shame or guesswork. Subscribe to this channel and turn on the notification bell so you never miss our evidence-based guidance for men's health after 60. Share this video with any man in your life who might be silently struggling with these changes. Sometimes the right information at the right time can transform someone's quality of life completely. In our next video, I'll explore how your daily self-stimulation habits can affect your health and when it's time to talk to a doctor. We'll discuss how to keep this private habit safe, how to avoid hidden risks, and how to recognize signs your body needs professional attention. Remember, this information is for educational purposes and should not replace personalized medical advice. Always consult a qualified healthcare provider before making changes to your health routine. I'm Dr. Sarah Mitchell, and I'll see you in the next video where we continue building your knowledge and protecting your health for years to come.